I think there is an opportunity to have what they call warm resources in place. So if you have a really active program of diagnostics and vaccinations in society, and you're processing people on day-to-day tests of the kind that you described, when the pandemic comes along, you have that infrastructure in place.
Yeah.
Diagnostics, the vaccines, the data, and the behaviors. Those are the four things you need. Now, you can't magic those things up from nothing.
No.
And nor can you have them sitting there cold, waiting to be used. That doesn't work.
No.
You need them ticking over, achieving public health outcomes. And scaling them up isn't so difficult, but starting from scratch is
really hard.
So painful.
Yeah, it's very expensive. Hard. And so at what point, I don't know whether you were involved or not, but I thought it was a very good idea that came out of the end of the pandemic around these central diagnostics hubs, the NHS diagnostics hubs. I thought that was an eminently sensible plan, but I don't know if that was something that was concluded as part of the pandemic work or whether it was already sort of in process anyway.
They have a long legacy. Aradazai talked about them in his review 15 years ago. Mike Richards, in his diagnostics review, had also posited them. Our experience in the pandemic was that people don't want to go to hospital. And this comes as a bit of a surprise to some in the clinical discipline. What do you mean? You don't want to come to my lovely hospital? No, I really don't. It's full of horrible disease and it's depressing. So taking tests to people was something that we worked really hard on during the pandemic. So the penny has dropped. I personally think it's a shame that we're not running harder at that. In fact, I think if we ran harder at community diagnostic hubs, we could be spending less on modernising our hospitals and taking more medicine to the places where people like to be. I think that the initial ambition was 100, and I think we've done up 86 of them. I kind of think there should be 586 of